Hi, I'm the audience.
Hi, my name is Sean No, and over the past 6 months, I've had the privilege of interning at the Cardiology Center of Houston under the mentorship of Dr. Randeep Saneja. One of the benefits of interning with Dr. Saneja, he's the first physician in Texas to utilize the new Pulse cardiac test. These past 3 months, I've been conducting research titled A Blood Test, Done in Vain, in order to study the true effectiveness and the use of the preventative blood test. But first, let's begin with some background on the test. After years of research, the test was first announced back in 2015 by scientists and doctors working at GD Biosciences. Their focus when creating this test was to develop a method to predict the likelihood of future cardiac events in patients. They found that a majority of heart attacks are actually caused by the rupture of unstable cardiac lesions, not the narrowing of arteries as is commonly portrayed. Now, what are cardiac lesions? Well, cardiac lesions are the result of continuous arterial damage and repair. When the lining of artery is damaged, as shown here, the immune system naturally tries to heal the injury. Over time, the cycle of damage and healing continues. The cardiac lesion forms as dead cells continue to build up at the injury site. These buildups become unstable cardiac lesions, as shown here, and when these rupture, blood clots can form and cause heart attacks. So the Pulse test attempts to detect this by testing the levels of 9 different biomarkers, shown on the right here. And together, they give physicians an idea of what's going on in a patient's arteries. So for this project, I was assigned 3 of the 9 biomarkers, the other 6 being split among the other interns, Anna and Priya. These included CTAC, SFAS, and HDL. However, before a patient is recommended a pulse test, there are certain diagnoses that the doctors look for. Here are just some of them. For example, you have atherosclerosis. It's the buildup of plaque in the arteries, hyperlipidemia, elevated levels of triglycerides and lipids, and hypoglycemia, and many of these other diagnoses. And there are many more that are also not listed that may make a patient eligible for the pulse test. So after analyzing patient medical data from the pulse test, I learned that doctors typically give what they usually get when they look at the results from the pulse test. When it comes to CTAC, my first biomarker, it's responsible for helping recruit white blood cells to injuries and inflammation. An elevated score for this may not cause immediate concern, but further examination may be necessary if it's paired with other things like chest pain. My second biomarker, SFAS, is part of the cell pathway that controls apoptosis of the cell. It's non-specific, but gives physicians valuable information when paired with other symptoms, such as chest pain. My final biomarker, HDL, is actually what you call a negative risk factor. The higher it is, the better it is for you. That's because HDL plays a role in removing bad cholesterol, LDL, from the arteries. So when the results come back from the pulse test, patients will be given a pulse score, shown here. Anything below 3.5 is normal, 3.5 to 7.49 is borderline, and anything above 7.49 is considered elevated. The higher the score, the more likely that the patient will develop a heart complication. So the most common way to start treating elevated levels of the pulse score is starting blood thinners like Plavix, shown here. These medicines ultimately help prevent strokes by reducing the formation of clots in arteries and limit the chance of a blockage forming. Over the course of this project, I've had the unique experience of researching this test and seeing its effects firsthand. The biomarkers I studied each offered one part of the puzzle to medical physicians. Combining all the pieces together completes the puzzle and gets doctors a high comprehensive idea of a patient's cardiovascular health. While the test is still new, its effectiveness as a preventive test is augmented by its ease of administration and its low risk, and its success isn't hard to imagine. So, in reality, I believe that the pulse test was not done in vain.